kind of the worst case scenario for many of us.
It's been 5 years since the world was changed forever. In 2020, the COVID-19 pandemic spread rapidly, taking millions of lives globally and forcing many more into lockdown. Good evening, I'm Brandon Morano.
And I'm Jennifer Roscoe. Schools and jobs went remote, medical facilities were overwhelmed, and normal life was put on pause. Now, 5 years later, researchers have a better understanding of the virus, but there's still more to uncover and a lingering social impact. WCIA 3's Gabriela Mirando is with us. And Gabriela, you talked with health experts. What did they say?
They told me the way things escalated so quickly is something rarely seen, if not ever seen before in healthcare. 5 years later, they are still trying to answer some key questions.
We hadn't seen anything like this since the 1918 flu pandemic.
Scientists knew it wasn't a matter of if, only when something like that would strike again.
2020 was kind of the worst case scenario for many of us. We knew that it was likely and we knew it could happen, but we thought we would have a better way to control it.
It's been 5 years since the World Health Organization declared COVID-19 a pandemic. Jobs became remote, masks covered faces, and scientists worked furiously to understand the virus.
The plan was basically to address it as an upper respiratory infection similar to other strains of coronavirus or the influenza virus. But very soon we found out this was not similar to anything that we had seen.
The WHO says millions have died from the virus worldwide, but science has come a long way from the initial shock of its ability to spread and mutate.
We started out knowing virtually nothing about this pathogen, and at this point we know more about it than almost any other virus.
Now researchers are left worrying about the pandemic's social implications.
And when politics and science, interact with each other, nobody wins.
I think we need people to be a lot more cautious about what science they're taking in and about who they're trusting and what experts they're trusting.
As the vaccine has been administered and cases have gone down, there's still a lot unknown about the virus.
I think we still don't understand how this virus was able to evolve so quickly. I don't think any of us were expecting this onslaught of variant after variant after variant.
Long-term effects are still a big question that will only be understood with time. Long-term COVID effects, its impact on certain organs, and the seasonality of the virus are what researchers are looking at now. Again, while cases have severely gone down, the researchers I talked to say the pandemic is ongoing, just less severe. They say it's not going away, but has become something that's better dealt with and treated. Brandon?
Gabriela, thank you so much.